Migraine headaches, the diagnosis, treatment, and prevention. This is your brain. You can have a migraine headache on one side, the front, the other side, or ultimately in the back. It affects your nervous system by your nerve endings telling your brain that you're having these symptoms. Everyone can get a headache, and it will go away with a little bit of over-the-counter medication or just rest. Not everyone will have a migraine. A migraine is a headache that is normally debilitating to the person that's having it. Not all people realize that they're having a migraine, and most importantly, that it can be diagnosed, treated, and ultimately prevented. A migraine is a headache that has several different symptoms that affect your nervous system. These symptoms can vary from person to person. These symptoms could start with severe onset, and you can feel them coming on for a day or two. Some people have symptoms such as light sensitivity, sound sensitivity, and nausea and vomiting. They can also have throbbing pain and pulsating pain in their head. Migraines can be in men, women, or children, most predominantly in women during puberty or in menopause due to a hormonal imbalance. Unfortunately, some of these symptoms go undiagnosed. Patients go undiagnosed, and they sometimes cannot function with a normal quality of life. They can have financial or personal disruptions due to these headaches. It's an injustice for men and women to feel that they cannot be accepted by just saying that they have a headache. And actually, it's a migraine headache that's a neurological genetic disorder. Most importantly, it can be diagnosed, treated, and prevented. Any person that's having these symptoms should be seen by a medical provider. A medical provider will try to rule out any other underlying condition that may be a cause for your headache. He or she may order an MRI or a CT scan, or they may also recommend a lumbar puncture. However, there's nothing in these tests or come back to say definitively that you are having a migraine. Your medical provider will basically ensure that you don't have another reason, such as a brain tumor, an aneurysm, or a bleed that would cause this level of a headache. As I stated earlier, there's been research to determine that there is a specific genetic protein that's called a calcitonin gene-related peptide that might trigger these migraines. This means your mother or father would have had this gene also, and they would have given it to you genetically. Once it is determined, based off of your symptoms, that you're actually having migraines, your provider will help you in the treatment process. Some of your symptoms may be vision loss, weakness, numbness, and you might see an aura with different shapes and bright spots. If you feel you're having these symptoms, you should keep a migraine diary, keeping up with the dates and times and any sort of triggers that may have started this process. Your provider will need this information, and it will help get a diagnosis much sooner. There are several different types of treatments for migraines. They are oral medications that you can take as prescribed by a provider, and there are also injections that you can take, also prescribed by a provider. Sometimes you can simply just adjust your physical surroundings by going to lay down and rest in a dark, quiet room or a place where there's less interruptions than in your normal life. The oral medications and injections have different types. One is abortive and one is preventative. What this means is that you can stop or slow down a migraine, and the preventative means that you'll take the medication regularly and routinely to make sure that you don't have a migraine. Some people will actually have breakthrough migraines and will need the abortive help in these particular situations. You will always have an abortive medication that can help you get through these. There are some downfalls to having migraines, and these are going to be the financial costs associated. There are some medications that are over the counter and they work just fine. And there are other medications that are the newest, latest technology, and they can cost thousands of dollars. Your medical provider will help you determine the best medication for you. However, if you are uninsured or if you have commercial insurance, it's likely going to be too expensive for a regular person to pay for these medications. If you have commercial insurance, your provider is going to have to prove to your health insurance company that you are a candidate for these medicines. They're going to have to give copies of your medical records and their determination of what's best for you, and ask basically for permission for your insurance to cover this. Sometimes your insurance company will come back and deny these and state that you have to try other medications that are less expensive for at least 6 weeks to see if you can benefit from those before going to the more expensive brands. If you're a self-pay, a lot of the pharmaceutical companies will actually have charity programs or indigent programs where you can fill out some financial information and they'll help you cover the cost for a specific period of time. Some of them will cover for a year, some of them will cover for a lifetime. They truly are going to cover you until their medication actually becomes a little bit less expensive. Please prepare yourself for the trial and error. The trial and error is going to be the medications that you can afford that are going to work best for you. And if you find something that doesn't necessarily work best for you, they're going to try to go to another level. Normally you have to show at least 6 weeks of the trial before you can move on to a newer name brand medication that's quite expensive. There are several different companies that manufacture these medications, and there's several different costs that are related to these medications. A regular income person may not qualify for this help. You have to have your insurance and you have to have all of your information together in order to get prior authorization through your insurance companies. No one truly has $1,200 a month for preventative medication that would actually help every person that has that genetic disorder. Once you and your healthcare provider go through a series of trial and error medications, there will be a light at the end of the tunnel. They will help you find the medication that's going to help you the best, that will help you maintain the quality of life. You should never feel guilty about having a headache so bad that you can't see or function in your everyday world. In healthcare in 2023, you should be able to find a medical provider that will listen to you, document your symptoms, and help you get the care that you need. They will advocate for you to get the medications at any cost and give you the different programs that are available in your area that can help you. Medical healthcare providers want you to live a normal life, and they want you to live day to day. You know your body and you know when something's not right. Please find a medical provider that can help you if you're having these symptoms for a migraine headache. You can be diagnosed, you can be treated, and you can prevent these migraines from coming on board and stopping you from having a normal life. You should not feel guilty, you should not feel embarrassed. It'll be fine.